Turf toe is a serious medical condition that can be season-ending and even career-ending. It can lead to long-term disability. When we think about turf toe, we usually think about NFL greats like Jack Lambert and Deion Sanders, both members of the Pro Football Hall of Fame, but athletes of numerous sports can acquire turf toe. What I'm going to do today is I'm going to go over exactly what turf toe is, go over the mechanism of injury, go over a little bit of anatomy, speak about prevention and rehabilitation. Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report, where I'm going to cover turf toe. Turf toe is also known as trigger toe, and it is usually associated with football. The term turf toe was coined around 1976 and coincided with the usage of artificial turf on football fields. It is an injury to the great toe. In everyday usage, the great toe is called the big toe, and in medical terminology, the great toe is named the hallux. I am going to call it the great toe throughout this video. Besides football, turf toe is an injury that can affect athletes who participate in numerous sports and activities, including but not limited to running, especially sprinters, basketball, volleyball players, soccer, lacrosse, gymnastics, wrestling, especially Greco-Roman wrestling, and dancers, especially ballet dancers. Turf toe occurs when the great toe is forcibly bent into hyperextension, such as when pushing off in a sprint position. The great toe has 2 phalanges, and toes 2 through 5 have 3 phalanges. The phalanges articulate with the metatarsal bones. The metatarsal bones connect the toe bones to the midfoot. The joint between the metatarsal bones and the phalanges is called the metatarsophalangeal joint. The metatarsophalangeal joint is often abbreviated to the MTP. The metatarsophalangeal joint is the area of the great toe where turf toe occurs. The flexor hallucis longus muscle is a muscle that is located in the foot, and it flexes the big toe, meaning that it curls the big toe towards the bottom of the foot. A couple terms that I want to go over so you understand when I'm speaking about the foot and the ankle are plantar flexion and dorsiflexion. Plantar flexion is when the ankle is flexed as if we are going up on our toes so that the bottom of the foot is moved towards the back of the leg. Dorsiflexion is the opposite motion. Dorsiflexion is an ankle motion where we are bringing the top part of the toes towards the front of the shin. Plantar flexion of the toes is also called flexion. Dorsiflexion of the toes is also called toe extension. Again, plantar flexion of the toes is called toe flexion, while dorsiflexion of the toes is named toe extension. The plantar plate is a deep fibrocartilaginous structure that originates on the head of the metatarsal bone, runs through the joint capsule, and attaches to the proximal phalanx. Its primary function is to stabilize the metatarsophalangeal joints. 2 sesamoid bones are located in the great toe. The medial flexor tendon encases the medial sesamoid bone, while the lateral flexor tendon encases the lateral sesamoid bone. These structures provide stability to the MTP joint by keeping the flexor hallucis tendon in proper alignment. The mechanism of injury of turf toe. When there is excessive upward bending of the great toe at the metatarsophalangeal joint, it results in a sprain of the posterior capsular ligament at the great toe's metatarsophalangeal joint. Hyperextension, also known as dorsiflexion of the great toe's metatarsophalangeal joint, especially at the flexor hallucis longus tendon and the sesamoid complex, results in a capsuloligamentous sprain. When an athlete accelerates, changes directions quickly, or stops suddenly in an explosive manner, they load more than 8 times their body weight onto that one great toe. This forces the metatarsophalangeal joint of the great toe into 70 or 80 degrees of extension. The injury may occur due to a single hyperextension injury or a repetitive great toe hyperextension injury. Symptoms of turf toe may include great toe pain, especially during push-off, joint stiffness, swelling, tenderness, redness, bruising, limited joint motion, reduced agility, inability to run and walk, an antalgic gait, limping may be possible, and long-term there may be joint deformity and poor foot biomechanics. If it is not treated early and properly, turf toe typically develops into a chronic injury. Long-term sequelae may include persistent pain, joint stiffness, decreased motion at the great toe metatarsophalangeal joint, impaired push-off, hallux rigidus, bunion formation, osteoarthritis, and improper foot biomechanics. Incorrect foot biomechanics can contribute to poor posture and lower extremity dysfunction. If one area is not functioning properly, another area must carry a greater workload, thus setting up that area for injury. Lower extremity dysfunction, including improper foot biomechanics, can lead to numerous conditions, including but not limited to low back pain, sacroiliac pain, hip conditions, thigh and knee pain, including iliotibial band syndrome. It can also contribute to shin splints, Achilles tendinopathy, and other foot conditions. Turf toe is classified by severity into 3 grades. The first grade, grade 1, the plantar complex, aka the plantar plate, is stretched. There is pinpoint tenderness and swelling. There is usually no bony pathology and no joint instability. Usually a normal active range of motion is present. In grade 2, there is partial tearing of the plantar complex, which causes more widespread tenderness, moderate swelling, and bruising. Great toe movement is limited and painful. Pain is present while weight bearing. And then grade 3, the plantar complex is completely torn, causing severe tenderness, swelling, and bruising. Great toe movement is difficult and painful. Early diagnosis and treatment are keys to rehabilitation and recovery. If treated early, turf toe usually responds well. If extrinsic and intrinsic contributing factors are limited, recurrence is less likely. Disclaimer alert, disclaimer alert. If you have turf toe or think you have turf toe or any other type of medical condition, please see a medical professional. Do not wait, do not hesitate. See a medical professional immediately. Watching this video does not take the place of seeing a medical professional. You can see a medical professional like myself, a doctor of chiropractic, or you can see another type of medical professional. But do not hesitate. Please see a medical professional if you think you have turf toe. Viewing this video does not take the place of seeing a medical professional. If you perform any type of exercise and it elicits or intensifies symptoms, please stop immediately and find a viable substitute. Please start any rehabilitation or exercise program at your current fitness, strength, and health levels. When you see a medical professional, imaging may be taken. These may include x-rays, bone scan, or an MRI, or a combination of any of these. Imaging will help the doctor to properly diagnose the condition. As I mentioned before, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada, and I am a doctor of chiropractic. In chiropractic care, the main tool that is used is what is called a chiropractic adjustment. The chiropractic adjustment helps to reestablish proper skeletal motion, and it helps to optimize nerve flow. I have treated numerous cases of foot and ankle injuries, including turf toe. The extremities can be adjusted as well as the spine. What I would do is I would check the entire kinetic chain, starting from the toes, going all the way through the foot, the ankle, the lower leg, the knee, the thigh, the hip, the pelvis, and all the way up to the spine. So the entire kinetic chain would be evaluated and treated. If you are diagnosed with turf toe, depending on which grade of severity that is present, you can use certain protocols. In grade 1, you want to use the RICE protocol. This is rest, ice, compression, and evaluation. You may tape the great toe to the second toe, and usually you can participate in sports. If not, return to sport time is usually short, about 2 weeks maximum. In grade 2 severity, immobilization in a walking boot for a short time may take place, typically about 3 to 4 days, and recovery time is typically 3 to 4 weeks. In a grade 3 injury, it is immobilized for 4 to 6 weeks, and time for complete recovery may take anywhere from 6 to 12 months. Prevention, prevention, prevention. Injury prevention is easier, faster, and less expensive than injury rehabilitation. So please use these techniques to help to prevent this condition, because as I stated before, this can be very performance limiting and it can turn into a chronic condition. So you want to prevent turf toe, and if you get turf toe, you want to start treatment immediately. Please see a medical professional immediately and start your self-treatment immediately. You can do things like self-mobilization of the foot and toe. What this is just moving the feet and the toes around with your hands, doing it very slowly and very gently. You don't want to overdo it. You're not trying to adjust yourself. You are just moving the bones of the foot and the toes very gently so that you are supplying motion to those joints. This is something that will help you to prevent your feet from getting too stiff. You can perform the foot motion exercises passively and actively. Passive foot motion exercises are when you are moving the toes and the feet with your hands. You can move your great toe through several motions. You always want to work through a symptom-free range of motion. And then you could advance to active motions, where you are moving the toes through a symptom-free range of motion. You can perform toe splaying, where you are lifting the toes and trying to spread them apart. And you could perform toe curling, which is when you are flexing the toes. These are good motion exercises that you can use to provide not only the toes, but the entire foot with motion. Other foot strengthening exercises that you can perform include the towel toe grab and the short foot exercise. These are both exercises that will help to not only strengthen the foot, but help to correct foot biomechanics. Again, the short foot exercise and the towel toe grab. I have videos on these exercises where I did a video on the foot strengthening exercises, and toe splaying and toe curling are included in that video, as well as the short foot exercise and towel toe grab. So you can watch that video. I will put a link to that video in the description box. You can perform exercises on a Bosu ball where you are working on your balance at the same time as strengthening the feet and the entire lower extremity. So the Bosu ball has different levels of exercise that you can do. You can do very beginner exercises, you can do intermediate exercises, or advanced exercises. I also have videos on Bosu ball exercises, so I will put a link to those in the description box below. Turf toe is a serious medical condition, so please use all the tools you can to prevent this injury. Again, turf toe can be season-ending and even career-ending and can lead to long-term disability. So please use all the tools you have to prevent turf toe. And if you get turf toe or think you have turf toe, see a medical professional immediately and start your rehabilitation immediately. Thank you everybody for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I went over turf toe. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You could visit my website, championshipchiropractic.com, where you can find out more information on the book, and you can also find a link to the Amazon page where my book is available. Also on my website, you can find my blog. My blog contains articles on sports medicine, chiropractic care, fitness, health, and nutrition. Thank you very much for watching today's video. Please like, comment, and subscribe. And always remember to train hard, but train smart. Utilize nutritional and supplementation strategies that work for you. Stay injury-free, prevent injuries, rehabilitate your injuries completely, and accomplish your goals.